Hello everyone, and welcome to Group M's presentation on aphasia. My name is Jessica Caggiano, and my other group members will be introducing themselves when they pop on to talk about the different aspects of this disorder. Today, we will be discussing what exactly aphasia is, as well as the different types, what swallowing and speech disorders co-occur, the risk factors that can lead to the development of aphasia, and the different therapies associated with its treatment. So, what exactly is aphasia? Aphasia is a disorder that results in a loss of language function due to injury in an area of the brain associated with the comprehension and production of language. There are a couple key components of aphasia that are important to understand before moving on to the rest of the presentation. This being that aphasia impairs four primary areas: the understanding of the expression of language, the comprehension of language, written expression, and reading comprehension. Aphasia can be defined into four prominent categories. These categories being expressive aphasia, which is the difficulty expressing thoughts through speech or writing; receptive aphasia, which is the difficulty understanding spoken or written language; global aphasia, which is the loss of most language function and comprehension as well as expression; and anomic aphasia, which is difficulty with using the correct names for people, places, and objects. To better understand aphasia, it will be helpful to have a solid understanding of the brain and its functions in relation to language comprehension and production. The two areas of the brain that are most closely associated with aphasia is the Wernicke's area and the Broca's area. These areas are usually localized to the left hemisphere of the brain for most right-handed individuals and 60% of left-handed individuals. These two areas of the brain work together so that we can process and produce language. To put this into perspective, imagine that you are listening to or reading a word. In order to comprehend this word, it will be sent to either the primary auditory cortex for hearing or primary visual cortex for reading. It will then be sent to the Wernicke's area for comprehension and then the Broca's area for speech production in order to generate a response. This is done with the help of the primary motor cortex in order to physically articulate what you want to say. So, based off this example, you can clearly see how damage to either one of these two areas may be detrimental for someone's communication. It is also important to remember that the type and severity of aphasia is dependent upon the localization of the injury that occurred. That is why we have numerous different types of aphasia that we will discuss in the next slides. The three types of aphasia we'll be focusing on today is Wernicke's aphasia, Broca's aphasia, and primary progressive aphasia. The first type of aphasia we will be discussing is Wernicke's aphasia, otherwise known as fluent or receptive aphasia. An individual that suffers from Wernicke's aphasia will have damage to the area of the brain located in the upper portion of their left temporal lobe. This area houses motor neurons responsible for the comprehension of speech and is closely associated with the auditory cortex, as we discussed in the last slide about the brain. An individual that suffers from Wernicke's aphasia will have the ability to comprehend the meaning of words and sentences, though their production of connected speech will remain relatively unaffected. Speech can be seen with normal fluency, rhythm, rate, and grammar, though the content of the speech is often hard to understand. As you can see in the bottom right-hand corner, an individual may be asking for an apple, and the speech will come out in a sort of jumbled manner. Errors produced in speech of people with Wernicke's aphasia is known as paraphasic language. This language is characterized by the production of unintended syllables, words, or phrases, and comes in two forms: semantic paraphasia and phonemic paraphasia. Semantic paraphasia is the substitution of one word for another. For example, an individual may be trying to refer to a door and instead produce the word window. Phonemic paraphasia is the substitution of one sound or syllable for another. This can be seen for an individual trying to produce the word hat and instead saying cat. The most common cause of this type of aphasia is ischemic stroke that affects the posterior temporal lobe of an individual's dominant hemisphere. Brain tumors, infections of the central nervous system, and degenerative brain disorders can also cause Wernicke's aphasia.
Hi, my name is Emma, and I'll be discussing the other two types of aphasia. The second type of aphasia is Broca's aphasia, which is also known as non-fluent or expressive aphasia. So individuals with Broca's aphasia have damage to the brain located on the frontal lobe of an individual's dominant hemisphere next to the motor cortex. And so that area in the brain aids the goal of allowing speech. Therefore, speech damage to that area results in difficulty producing speech. And that is due to a neuromuscular dysfunction while comprehending speech. There's also a loss of grammatical structure, such as conjunctions and prepositions. So an individual with Broca's aphasia may produce a sentence of "let's take a walk to the park" as "let's walk park." And speech is often slow and slurred for individuals with Broca's aphasia, so they also have a difficult time understanding words. The Broca's area is also responsible for converting thoughts to spoken language, so oftentimes individuals with Broca's aphasia have a difficult time producing what they want to say, even though they know exactly what they want to say. So that is very frustrating for them. And the most common cause for Broca's aphasia is a stroke that impacts the Broca's area in the brain. The third type of aphasia we will discuss is primary progressive aphasia, which is also known as slowly progressive aphasia. Primary progressive aphasia is a relatively rare clinical dementia syndrome that is caused by neurodegenerative brain disease, such as Alzheimer's disease. Although it's possible to regain abilities with a brain injury, primary progressive aphasia symptoms worsen and other symptoms emerge within time, which shortens the lifespan. So individuals with primary progressive aphasia have their language skills slowly and progressively become impaired and eventually have complete memory loss. And in its most severe stage, individuals with primary progressive aphasia lose the ability to speak and become unable to understand both spoken and written language. Treatment of primary progressive aphasia must be carefully differentiated from treatment of aphasia after a stroke. So SLPs are uniquely trained not only to provide treatment-focused compensation strategies, but also to connect the individual with the necessary resources and provide much needed counseling. And so caregivers and family education and training is also important for any diagnosis and is critical in treating those with primary progressive aphasia. And so for the next slide, we have an interview with a speech-language pathologist named Paula Masana. Ms. Masana is a SUNY graduate from Fredonia, who is also an SLP in Buffalo Public School number 30.
Sabita.
Okay, how often do you see a child with aphasia?
I have been practicing for nearly 20 years, and one time I had a child with aphasia.
Okay.
One time.
So how does the treatment of aphasia differ in adults and children?
Well, I think that therapy differs anyway for adult and children. However, with aphasia, you may have to come down to a level that the person can understand that has aphasia, which may be very, very childlike. So the goals and the objectives should be targeted at the adult level using material that would be adequate for a child.
Okay.
No, it wouldn't be fair to talk to an adult, and it wouldn't be therapeutically correct to work with someone and treat them as though they were 5 when they're 75. I mean, it's just not ethical.
Okay. When would you discharge a patient with aphasia?
That's a tough question. I would say when they plateau. So here are the goals that you set. Here are the objectives that you set. So let's say that we set our goals and objectives our goal at 80%. And they met all the objectives at like 60%, 70%, 80%. And now we just keep getting the same responses. I would say that the person plateaued, and it would probably be time to discharge them at the time that they plateaued.
Okay. Thank you.
Welcome.
My name's Emily, and today I will be talking about childhood aphasia. Childhood aphasia, also known as pediatric aphasia, occurs in similar ways to adults, like trauma or stroke. Childhood aphasia can happen at any point in time from utero to during birth or any time after that. Pediatric aphasia, while classified as a language disorder, differs from other typical childhood language disorders, and therefore the approach and treatments of the disorder will differ. It is the most beneficial for a child to see a speech-language pathologist that specializes or is experienced in treating children who have had a brain injury or trauma. Children may also require a teacher's aid for more assistance.
Hi, my name is Mary, and I'll be discussing the signs and symptoms of aphasia. I'll also talk about the prevalence of aphasia and common therapy approaches for treating aphasia. Signs of aphasia can be seen in multiple modalities of language. Language skills like speaking, writing, and reading are extremely affected by aphasia. A common symptom of aphasia is impairment of spoken language expression. In everyday language use, this can look like difficulty finding the right words to describe objects or making them up. Impaired spoken language expression can also sound like speech that's very effortful and fragmented. Incorrectly substituting sounds or words is also common. An example of this would be saying thread for bread. In addition to impaired spoken language expression, spoken language comprehension is also often impaired. A person struggling with spoken language comprehension may show difficulty understanding speech and could likely need extra time to comprehend what's being said to them. They may especially have difficulty comprehending complex grammar and fast rates of speech. Some signs that someone is having difficulty with spoken language comprehension could be someone providing unreliable answers to yes or no questions. Misinterpreting language, like confusing figurative and literal language with one another, is another sign that someone is having impaired spoken language comprehension. Another symptom of aphasia is impaired written expression. This is called agraphia and is categorized by difficulty writing or copying letters, sentences, or even just words. The writing produced may have incorrect grammar and consist of run-on sentences or sentences that don't make sense. Syntax errors and spelling errors are another two things to look out for. Another symptom of aphasia is impairments of reading comprehension. This is called alexia. It's categorized by difficulty to comprehend written words and an inability to sound out words. Difficulty recognizing words is also a common thing for someone experiencing alexia to have. Looking at the prevalence of aphasia, we know that 1 in 250 people in the United States have been diagnosed with aphasia. This accumulates to be about 1 million people. Therapy for those with aphasia may focus on the resulting impairments or on communication improvement. Therapy may also focus on both of these things. Impairment-based therapy aims to improve language functions. It consists of procedures where the clinician directly stimulates listening, speaking, reading, and writing skills. The communication-based component of therapy is intended to enhance communication by any means. Encouraging support from caregivers and incorporating the communication partners of a person with aphasia can help relieve some of the communication challenges faced by this client.
Swallowing and speech disorders co-occur with aphasia. There are 3 disorders that can co-occur with aphasia. There are apraxia of speech, dysarthria, and dysphagia. Apraxia is the neurological disease in which there are impairments in carrying out purposeful movements. Apraxia of speech is an impairment in the voluntary production of articulation and prosody of speech. The brain cannot coordinate the oral and facial muscle movements needed to create certain sounds. This disorder, however, is not typically due to muscle weakness. Dysarthria is a group of speech disorders resulting from weakness, slowness, or incoordination of speech mechanisms due to damage to any variety of points in the nervous system. People with dysarthria tend to have problems with muscle control. The last disorder to co-occur with aphasia is dysphagia. Dysphagia is difficulty swallowing or pain while swallowing. Some people may be completely unable to swallow, while others find certain foods or textures harder to swallow than others. Known causes of aphasia. There are a few known causes of aphasia. The first is brain trauma. Aphasia can be the result of a brain injury or head trauma. Brain tumors can also cause aphasia if they grow or spread to the language centers of the brain. This type of aphasia is called neuroplastic aphasia. Dementia can also cause aphasia because it is a condition of an impairment of memory, intellect, personality, and insight resulting from brain injury or disease. However, language impairments are often overshadowed by more widespread intellectual loss. A stroke can cause aphasia. Strokes are the number one cause of aphasia, with 25 to 40% of stroke survivors developing aphasia. Bleeding in the left side of the brain can cause aphasia, as the blood affects language centers in that part of the brain. Infections of the brain can also cause aphasia from diseases that include encephalitis, meningitis, or a brain abscess. All of these causes of aphasia occur when there is damage to the language center of the brain. What are the risk factors associated with aphasia? Aphasia can occur suddenly after a stroke or head injury, but can also develop slowly due to a brain tumor or degenerative neurological disease. Cerebrovascular accident, CVA, or a stroke is one of the most prominent causes of aphasia. Other risk factors include tumor, infection, toxicity, and metabolic and nutritional disorders that may cause damage to the brain. Epilepsy, seizure, or a migraine can also cause temporary aphasia. Age is also a risk factor due to the fact that most strokes and neurological problems occur later in life. Thank you for listening. This has been Group M's project on aphasia.